in 2012 did issue, they had studied 14 million births. And what they found is that delivered by midwives had a 12.6 per 10,000 rate of death. But first-time deliveries by a lay midwife had a 21.9% per 10,000 births on death. So there are some safety issues related to that. And one of you asked earlier about are there any articles or anything like that. If you just Google lay midwife deaths on the internet, you will see many news stories pop up about trying to deliver a 13-pound baby at home and the baby died. Using medications and vacuum assist devices and the baby died. Those stories are out there, and you can find them easily just by going to the internet. Now, the Board of Nursing does regulate certified nurse midwives, as John talked about earlier. They do have 8 years of education, they are properly trained, and they are in a collaborative practice agreement with the physicians here in the state that ensure that those deliveries are delivered safely, that train them, that assist them to grow and to learn. And what I'm concerned about is that the education level for the lay midwife does not meet the standard of the care that we want to deliver here in Alabama. We want to protect our patients. And as Massa spoke earlier, if you can save one baby or 18 or 20 babies in the state of Alabama, it's worth opposing this bill. That's all I have to say.
When you look at what other states have done as it relates to the lay midwife, have y'all looked at that statistic?
No, there's not any data out there that I can find other than CDC report.
But there are other states, I'm not sure, I don't remember the number now, but there are a large number of other states that allow this. And so I think when we talk about that, look at what other states have done and the statistics, I'm just looking at a fair way, and always we seem to be one-sided on this issue. It's the medical community versus the lay community. And there are other states that are doing this. I don't get it.
You know, one of the things I would suggest is maybe have an advisory council with the Board of Medicine and the Board of Nursing to look at something like that, to how do we see if there are any physicians or nurse practitioners, certified nurse midwives rather, who want to do home deliveries. I don't know that there are, I don't know that there is, but it's something that we could ask and put on the table. But that would have to be the physician willing to do that as well. But no, I have not looked at the 30 states that provide this. The data is just not out there, and what I have looked at is the CDC report, which was very concerning on a 14-month birth.
Okay, so you're saying the data from the 30 states are not available?
I have not looked at it. I said I'm not sure whether it's available or not. I'm just concerned from a safety standpoint and to protect the public.
You said 12.6% per 10,000. What was that figure? What was it saying?
It says, from using the CDC data collected, 14 million infant births and deaths, the research team learned that the rate of newborn deaths was greater for home births delivered by midwives, 12.6 per 10,000, compared to births delivered by midwives in a hospital, which would be the certified nurse midwives, which is 3.2. And the death rate was even greater for first-time mothers having a midwife delivery at home, and it was 21.9 deaths per 10,000 births. So it clearly demonstrated that there was issues. But what is concerning
is... someone gave some information. I guess 12.6 per 10,000 is about, what, 1.3 per thousand? They compared it to 1.8.
That was a different report that she did from
I know, but it's
Oregon.
apples is apples. It might be a different report. Talking about deaths per thousand.
Yeah, but that was for Oregon. This is nationwide that they did.
Okay.
So, you know, one state may be different from another state.
Okay. Okay.
So it wouldn't be apples to apples.
But it's within a couple of percentage points difference.
Well, it just shows that it's 3 times likely for infant death.
When you say lay midwives, that the CDC study differentiates between lay midwives with no training versus certified professional midwives that are recognized in the United States?
I don't differentiate that.